Hello, my name is Thorsten Voigtländer and I'm the head of the Internal and Gastroenterology Department of DRK Krankenhaus Clementinhaus in Hanover, Germany. I'm very excited that I can present my data and my study called Study to Improve Brushing for Indeterminate Bile Duct Strictures, the SIMPLE study. First of all, I have to state that indeterminate bile duct strictures are a clinical challenge. On the one hand, you have benign bile duct stenosis, such as post-operative iatrogenic bile duct stenosis following liver transplantation, for example, anastomotic strictures or ischemic type biliary lesions, chronic pancreatitis, or primary and secondary sclerosing cholangitis may lead to benign bile duct stenosis. On the other hand, there's a big field of malignant bile duct stenosis, for example, cholangiocarcinoma, gallbladder cancer, HCC, and other tumor entities may lead to malignant bile duct stenosis, and these stenosis have to be analyzed with great caution. As one of the first diagnostic steps, ERC is used in order to analyze bile duct stenosis. The sensitivity of ERC alone to detect tumors ranges from 41 to 85% in the literature, with a specificity of 70 to 100%. The detection rate of tumors may be enhanced when you use other devices or other approaches combined with ERC, such as cholangioscopy, bile fluid analysis, biopsy forceps, or brush cytology. When you use specific endoscopic devices, such as biopsy forceps or brush cytology, you may augment your tumor detection rate. For biopsy forceps, the sensitivity to detect tumors ranges from 30 to 84%, with a specificity of 100%. For brush cytology, you can find in the literature a sensitivity of 15 to 75% for tumor detection, with a specificity of 89 to 100%. This data reflects the heterogeneity of the study population, the studies, and maybe also of the experience of the endoscopists to analyze bile duct stenosis. There's a new ERCP sampling device on the market called Infinity, and as you can see here, the setup or the composition of this brush is a bit different. You have stiffer bristles on top and the end of the brush, and in the middle you have softer bristles which may help to capture abraded material which is abraded by these stiffer bristles. There are also gaps in the middle which may help to collect the cells. And here again the direct comparison of this new brush design to a conventional brush. On the lower picture you can see there's only one layer of bristles and it's smaller compared to this new device. After release of this new ERCP sampling device, we asked ourselves if we can improve results for brushing of indeterminate bile duct strictures. So we set up a study called Study to Improve Brushing for Indeterminate Bile Duct Strictures, the SIMPLE study. So we prospectively enrolled consecutive patients with indeterminate bile duct strictures from June 2019 to July 2021 at Hanover Medical School, where I was the head of the endoscopy unit. We evaluated the Infinity ERCP Sampling Device versus our standard device, which we used regularly to analyze bile duct stenosis. Our pathologists were blinded for the specimens and they analyzed both brushes. In our study, both brush devices were applied in all patients. We used an alternating order of the brushes, which means that in the first patient we used the ERCP sampling device Infinity at first position, then the conventional brush at second position, and in the next patient we did it the other way around. Both brush devices were passed at least 5 times over the stenosis. We placed the specimens on 4 specimen slides, and the tip of the brush was additionally analyzed by the pathologists. In our study, we performed at least 6 months of follow-up, and we performed a clinical, radiological, and bioptic control for tumor development. Our objectives were that we wanted to find out Is there a difference in cellularity for both brush devices? Can we find more correct diagnosis with one device? Or is the malignancy detection rate better in one study arm compared to the other? Now I can present you some results from the interim analysis of our simple study. We included 101 patients, and as far as cellularity is concerned, we found out that in 91%, which means 92 out of 101 patients, we had a moderate to excellent cellularity for the Infinity sampling device versus 74%, which means 75 out of 101 patients for the standard device. This was a significant difference between both study arms. As you can clearly see from the pictures on the bottom of this slide, the Infinity ERCP sampling device abraded more cell material compared to our standard brush. As far as correct diagnoses are concerned, we found out that in 71% or 72 out of 101 patients, we found the correct diagnosis for Infinity ERCP sampling device versus 60% for the standard device, which means 61 out of 101 patients. This was a significant difference between both brush devices. For high-grade atypia or neoplasia detection, we found out that the diagnosis was correct in 59%, which means 16 out of 27 patients for the Infinity ERCP sampling device versus 37, which means 10 out of 27 patients for the standard device. This was also a significant difference between both brushes. Performance of brush cytology is a safe and secure procedure in experienced hands. In our study, we had 2 complications out of 101 examinations, which means 2%. We had 1 perforation of the bile ducts in a patient with PSC, but the perforation was not evident during ERC, so we cannot clearly say which brush device led to this complication. However, perforation of the bile ducts is a typical complication in patients with PSC because they have several, in most cases, severe stenosis, which may lead to perforation in therapeutic ERC. We had 1 self-limiting bleeding from the bile ducts after Infinity ERCP sampling device, which is translated to a percentage of 1%. Let me summarize our study findings. The Infinity ERCP sampling device obtains significantly more cells compared to standard devices. The Infinity ERCP sampling device delivered more correct diagnosis in our study compared to conventional brush cytology systems. The tumor detection is of high clinical importance and still has to be improved. But we could show that the Infinity ERCP sampling device abrades more cell material, and this higher cellularity may be a diagnostic approach for new innovative diagnostic approaches such as FISH analysis from abraded cell material from the bile ducts. Finally, I want to thank for your attention, and if you have any questions, please don't hesitate to ask, and cooperations and study projects are always welcome, so if there are needs or questions, please don't hesitate to contact me. Thank you for your attention.